My name is Tracy Joshi, and I'm a nurse practitioner at the Boston University Amyloidosis Center, specializing in amyloidosis. Today, I'll guide you through what AL amyloidosis is and how it's diagnosed. My goal is to make this information easy to understand and help you feel more confident about your diagnosis and treatment journey. To understand AL amyloidosis, let's start by breaking down what the name means. AL stands for amyloid light chain, referring to the abnormal protein that causes this condition. Now let's think about this as a simple good versus bad protein story. Plasma cells live in the bone marrow and normally produce antibodies which help fight infections. These antibodies act like little tiny warriors attacking harmful invaders to keep us healthy. Healthy plasma cells, or good proteins, produce antibodies to fight infections. They keep the immune system balanced and functioning properly. When we have abnormal plasma cells, or bad proteins in AL amyloidosis, the loss of control and producing abnormal antibodies and excessive free light chains. These light chains misfold and turn into amyloid deposits instead of helping the immune system. Over time, these deposits build up in organs, disrupting their normal function and leading to serious health complications. This shift from healthy plasma cell producing helpful antibodies to abnormal plasma cells making harmful amyloid proteins is the key to understanding AL amyloidosis. Now, while AL amyloidosis is not a cancer, it is closely related to abnormal plasma cell disorders like multiple myeloma. Now, diagnosing AL amyloidosis is a step-by-step process that helps ensure the right treatment plan is developed. Because amyloidosis can mimic other conditions, it's important to go through a structured approach to confirm the diagnosis. Here are 5 steps. The first step is recognizing the signs and symptoms that might suggest AL amyloidosis. If clinical suspicion is there, labs should be done to check for abnormal proteins or light chains. The next step is a biopsy to confirm the presence of amyloid deposits inside of the body. Once AL amyloidosis is confirmed, staging tests to help determine which organs are affected and how advanced the disease is. Once the type and stage of AL amyloidosis are determined, a treatment plan is developed. Each step in this process is important to ensure the right diagnosis and treatment plan. The sooner AL amyloidosis is identified, the sooner treatment can begin to prevent further organ damage. In the next slides, we'll go deeper into each of these steps and what they mean for you. Step 1. Once those abnormal light chains are produced, they travel through the bloodstream and start accumulating in different organs. This buildup of amyloid deposits interfere with normal organ function and lead to a wide variety of symptoms. The specific symptoms depend on which organs are affected. Amyloid deposits in the heart can cause walls to thicken and stiffen, making it harder for the heart to pump. This can lead to heart failure, shortness of breath, fluid retention, irregular heart rhythms. The kidneys act as a filter system, removing waste from the blood. When amyloid builds up, the filters become damaged, leading to protein inside of the urine. swelling in the legs and around the eyes, progressive kidney dysfunction. The nervous system can also be affected, causing neuropathy, which may present as numbness or tingling in the hands and feet. You could also have autonomic dysfunction where blood pressure regulation is an issue. You'll get lightheadedness when standing. In some cases, amyloid can deposit and affect soft tissue, leading to an enlarged tongue called macroglossia, which can cause difficulty speaking, swallowing, or even breathing. Periorbital ecchymosis, or raccoon eyes, which appears as bruising around the eyes due to fragile blood vessels. Amyloid can deposit in the liver and digestive tract, leading to an enlarged liver, digestive problems such as diarrhea or constipation. Malabsorption of nutrients or unintended weight loss. Because AL amyloidosis can affect multiple organs, symptoms often mimic those of other conditions. Many people go through months or even years of testing before they get a correct diagnosis. That's why recognizing the symptoms early and undergoing the right test is so important. To diagnose AL amyloidosis, we need to look for the bad protein that causes the disease. These proteins are called light chains and are made by abnormal plasma cells and can misfold, leading to the amyloid deposits in different organs. Blood and urine tests help us detect these proteins and determine if AL amyloidosis is a concern. The three key tests for AL amyloidosis are serum-free light chain assay. So think of light chains as building blocks of antibodies. This test measures free kappa and lambda light chains in the blood. If the ratio is too high or too low, it suggests that there's an imbalance, meaning the body is making too many misfolded proteins. Serum protein electrophoresis, or SPEP, and immunofixation electrophoresis is a laboratory test that analyzes the different proteins in the blood to identify abnormal antibody production. Immunofixation further pinpoints the specific abnormal proteins that may suggest an underlying plasma cell disorder. This test looks for M proteins, which are abnormal proteins found in the blood. M proteins are a sign that plasma cells are misbehaving and producing excess light chains. Urine protein electrophoresis and immunofixation are similar to the SPEP test, but checks the urine instead of the blood. And this helps detect any M proteins leaking into the urine, especially when amyloidosis affects the kidneys. By measuring these proteins, we can see if the body is producing too many bad proteins and start connecting the dots towards a diagnosis. So why these tests matter? It helps diagnose AL amyloidosis because if the tests find an imbalance in the light chains or M proteins, AL becomes a strong possibility. It monitors the disease progression. So if there's treatment is working, the amount of bad proteins should decrease over time. It also tracks treatment response. If light chains go down, it means the therapy is reducing the abnormal plasma cells, which is a good sign. So these tests act as a detective looking for clues. If we can find too many bad proteins, we move to the next step, confirming the diagnosis with a biopsy. So if AL is suspected, if we see two key indicators from the test, so an abnormal serum-free light chain ratio, the normal kappa lambda ratio falls in between 0.26 and 1.65. If this ratio is elevated or skewed, it could suggest an overproduction of light chains, which can lead to amyloid buildup. Now, presence of a monoclonal protein in the serum or urine, if an M protein are detected, this can signal that abnormal plasma cells are making excess light chains, a hallmark of AL amyloidosis. Now, finding these abnormalities don't confirm amyloidosis, but strongly suggest that further testing, including a biopsy, is needed. So if the test results are positive, you're going to move to step 3 and get a biopsy confirmation to confirm the amyloid deposits. If the tests are negative, consider other types of amyloidosis like ATTR or AA amyloidosis, which require a different diagnostic approach. One of the most important steps in diagnosing AL amyloidosis is obtaining a tissue biopsy. A biopsy involves taking a small sample of tissue from the body to examine underneath a microscope. This helps to confirm the presence of amyloid and determine the specific type of amyloid protein. There are many places a biopsy can be taken, but you only need one to confirm the diagnosis. An abdominal fat pad biopsy is a simple, minimally invasive procedure where a small sample of fat is taken from the abdomen. This is often the first choice because it is low risk and easy to perform, but it's not always positive. Bone marrow biopsy, since AL amyloidosis starts with an abnormal plasma cell, this biopsy helps detect any blood-related issues, and plus, amyloid can deposit inside of the bone marrow. If amyloidosis affects the heart, a small tissue sample may be taken from the heart muscle to confirm the amyloid buildup. When protein is found in the urine or kidney function is worsening, a kidney biopsy can help determine if amyloid is affecting the kidney. If blood tests suggest changes in the liver function, a biopsy can check for amyloid deposits in the liver. Amyloidosis can also affect the digestive system. So in these cases, a biopsy may be done during a procedure like an endoscopy or colonoscopy to check for amyloid buildup in the digestive tract. In some cases, a tongue or rectal biopsy have historically been used. The type of biopsy depends on which organ is affected. The specialist managing that part of the body will determine the most appropriate biopsy method to confirm the diagnosis. Once a biopsy sample is taken, the next step is to confirm whether amyloid deposits are present. The first step is applying a special dye called Congo red to the biopsy sample. This stain binds to amyloid proteins, making them easier to see underneath a microscope. Once stained, the sample is viewed underneath a polarized microscope. If amyloid is present, it will show a unique pattern known as green bifringence. This is a hallmark of amyloidosis. If green bifringence is seen, amyloid is officially confirmed. But we still need to determine the type of amyloid protein to guide the treatment. There are 2 key tests for this. Mass spectrometry is a highly sensitive test that can identify the exact type of amyloid protein. Now, immunohistochemistry uses antibodies to detect specific types of amyloid. This process from biopsy to advanced testing is key to confirming amyloidosis and making sure each patient gets the right treatment for their specific disease. If AL amyloidosis is confirmed, proceed to step 4, staging and organ involvement. This means the amyloid deposits have been detected, and additional testing are needed to see which organs are affected and how severe the condition is. Staging helps us guide treatment decisions by assessing the heart, the kidneys, and other organ involvement. If amyloid is not found and we have a negative biopsy, reevaluate for some other conditions. A negative biopsy does not always rule out amyloidosis, especially if symptoms are strongly suggestive of disease. In some cases, another biopsy from a different organ or tissue may be needed. If amyloidosis is still suspected, but no amyloid is found, other conditions like ATTR or AA amyloidosis should be considered. Now that AL amyloidosis has been confirmed, the next step is hematological staging, evaluating how the disease is affecting the bone marrow and the blood. Since AL amyloidosis originates in a plasma cell, this step focuses on measuring the overproduction of faulty light chains leading to misfolded proteins and determining how aggressive the disease is. To better understand the extent of the disease, we evaluate how many plasma cells are involved and which plasma cells are producing an excess light chain. So bone marrow biopsies are looking for clues, and a bone marrow biopsy in an aspirate is performed to assess how much of the bone marrow is affected and to check for genetic changes that might influence treatment. Key tests done on the biopsy sample include flow cytometry, which identifies the type and the number of plasma cells involved and how abnormal they are. Cytogenetics look for any chromosomal abnormalities that help predict the disease behavior. And FISH, fluorescent in situ hybridization, detect any specific genetic mutations that may impact treatment options. This helps identify any high-risk genetic markers that may require a different treatment strategy. This also helps track the disease progression and treatment response over time. Now that we've assessed the plasma cells in the bone marrow, the next step is to evaluate how amyloidosis is affecting different organs. This process, called organ staging, helps determine the severity of the disease and guides treatment decisions. Since amyloid proteins can deposit in multiple organs, testing is done based on symptoms and suspected involvement. AL amyloidosis commonly affects the heart, causing thickened walls, stiffness, and heart failure. To evaluate the extent of the involvement, we use an EKG or an electrocardiogram, which measures the electrical activity of the heart. It can detect any low voltage, which is a common clue for cardiac amyloidosis. It helps identify arrhythmias or irregular heartbeats that may cause by amyloid deposits. Blood work with NT-proBNP, BNP, and troponin I or T, these blood tests measure the heart strain and damage. Higher levels suggest that amyloid is impacting the heart's ability to function properly. An echocardiogram is a heart ultrasound that checks for thickened heart walls and how well the heart is pumping. Can also detect stiffness in the heart, a hallmark sign of those amyloid deposits. A more detailed image is a cardiac MRI that can detect any amyloid infiltrates in the heart and can differentiate amyloidosis from other heart diseases. Since cardiac amyloidosis can significantly impact prognosis, identifying heart involvement early is crucial for guiding treatment and improving outcomes. After assessing the heart, the next step is to evaluate how AL is affecting the other vital organs, including the kidneys, liver, and nervous system. Since amyloid deposits can disrupt normal function in multiple areas of the body, these tests can help determine the severity of the disease and guide treatment decisions. The kidneys act as the body's natural filters. But when amyloid deposits build up, they disrupt their ability to remove waste and excess fluid. A 24-hour urine protein test checks for protein loss in the urine called proteinuria, which is a common sign in kidney amyloidosis. If the kidneys are affected, swelling and declining kidney function may occur. The liver plays a crucial role in digestion and metabolism, but amyloid deposits can cause liver enlargement and abnormal liver enzyme levels. Liver function tests and imaging are used to assess whether amyloid is impacting the liver's ability to function properly. Some patients may experience digestive issues or discomfort due to liver involvement. Amyloid deposits can affect the nerves, leading to neuropathy, which can cause a range of symptoms. Autonomic and peripheral nerves test help identify whether nerve damage is occurring, and symptoms may include numbness, tingling, dizziness, and difficulty regulating blood pressure. By understanding which organs are involved, we can create a treatment plan that targets both the root cause, the plasma cell overproduction of the bad protein, and the damage already done to the vital organs. Once AL amyloidosis is diagnosed, the next step is treatment. The goal is to stop the bad proteins from being made, protect organs, and help you feel better. There are 3 key parts to treatment. The main focus is to stop the plasma cell from making amyloid proteins. This could include chemotherapy, which helps destroy abnormal cells making bad proteins, targeted therapy, which uses newer drugs to attack the amyloid producing cells, or stem cell transplant. Some people may qualify for this to replace the damaged cells. Next is managing symptoms and quality of life. Since amyloidosis is affecting different organs, treatment also focuses on managing symptoms like swelling and fluid buildup, which is treated with medications like diuretics. Nerve pain or dizziness, medications can help improve the nerve function. Digestive issues like nutritional support and diet changes may help. Now, checking for clinical trials, there are new treatments being researched all the time. A clinical trial could provide early access to promising treatment. With the right treatment and support, we can slow down the disease, manage symptoms, and help you feel as good as possible. Now, we have covered a lot today, and I want to take a moment to summarize the key points. What is AL amyloidosis? This happens when abnormal plasma cells make misfolded light chains or bad proteins that build up in organs and cause damage. It's not cancer, but it's related to disorders like multiple myeloma. How AL amyloidosis is diagnosed? Lab test. Check for this abnormal light chains in the blood and urine. A biopsy confirms the amyloid buildup in the tissue, and organ staging helps us understand how the disease is affecting different parts of the body, especially the hearts, kidney, liver, and nerves. Now, why early diagnosis and treatment matter? Because stopping the bad proteins early help protect the organs and slow the progressions of the disease. Treatment like chemotherapy or targeted therapy and stem cell transplant work to stop the plasma cells from making the amyloid proteins. Supportive care helps manage the symptoms and improve quality of life. Now, looking ahead, every patient's journey is different. AL amyloidosis requires a personalized approach, and treatment is designed to fit your needs. There are new therapies and clinical trials that offer hope for even better outcomes in the future. You do have any questions, I encourage you to reach out to your doctor or find more information at the Amyloid Research Consortium. Thank you so much for your time.